Welcome to Case Western Reserve. We hope to provide you with some useful information as you start your journey into nursing. My name is Lorraine Gaikowski, and I am one of the first-year nursing advisors, along with my colleague Kathy Money, and Erin Discenza will also be one of the first-year nursing advisors. In addition to your nursing advisor, you'll also have a SAGES advisor that you'll learn about as orientation gets closer.
Where? Francis Payne Bolton School of Nursing is located south of Euclid at the Health Science Complex with medicine and dentistry buildings. Here is a small map of the area. Most of your classes will be in the nursing building to start. You will also have biology, SAGES, on your electives elsewhere on the CASE campus. You can find other maps at case.edu.
So we're kind of reviewing the who, what, when, where, why of starting your journey into nursing. The 4 whats that we hope to cover are nursing as a major at Case Western Reserve, registering for your fall classes, the mandatory requirements that you need to complete during the summer, and the nursing orientation that'll occur in August. Let me first start with nursing as a major at Case Western Reserve. The program requires 4 years to earn your Bachelor of Science in Nursing degree. Your academic experience combines classroom learning, lab skills training, and clinical practice. Most students enter the program in their first year, but some students do transfer into the program. If you are a current Case Western Reserve University student who's interested in transferring into nursing, please contact the Office of Undergraduate Studies as soon as possible.
Registering for your fall classes. This slide shows our courses that you will be taking. Most students register for 17 credits that first fall semester. There's Nursing 110, Foundations of the Discipline, Nursing 111, Foundations of the Practice, Nursing 277, which is our CPR and first aid, and you will get certified in that. We'll talk about that in a minute. Biology 114 is Principles of Biology, and then Biology 116 is the first of 2, Human Anatomy and Physiology. This is the first one in the fall. You'll also have a SAGES first seminar and a general education requirement, or sometimes referred to as a GER. That can be an arts and humanities or a social science, or you may have a phys ed activity course or a varsity sport. Here is the layout also of the classes I've just talked about. Again, the Nursing 110 Foundations of the Discipline meets on Wednesday, 3 to 3:50 or 4 to 4:50. It's a 1-credit course. Nursing 111, Foundations of the Practice, meets on Mondays, 3 to 4:15 or 4:30 to 5:45. These classes, the nursing and the biologies, we are going to pre-register you for. Your advisor, we're going to do that in the coming months. Also, if you're in a fall sport, you will be in the earlier time class of that Nursing 110 and 111. Biology 114, again, Principles of Biology, meets Monday, Wednesday, Friday, 11:30 to 12:20. We will pre-register you for that. Also, the AP credit there is mentioned because if you have had AP Biology in high school, and depending on your score, you may, with a high score, be able to get credit for that Biology 114. Biology 116, Anatomy and Physiology 1, meets Monday and Wednesday, 9 to 10:15 in the morning. It's a 3-hour course. Then again, Nursing 277, the CPR and first aid, that will be during the orientation week. The dates are listed there, 8/19, 8/20, and August 22nd. It is a half credit. It goes toward your phys ed credit, and we will pre-register you for that. The SAGES first seminar is your choice. You will be hearing from the SAGES department on getting your interest and assigning you one of those classes. And then also, as I mentioned, the GER, the general education requirement, or the phys ed might be able to be done, but you will register for that on CIS, and you will get more information on that. This is another way, just a weekly look at the schedule. I won't read those times again, but I want to point out on this slide the clinical times. So as you can see, on Tuesday, there are 4 time slots, but you'll only be in one. So Tuesday, 7 to 11 is a choice. Tuesday, 11:30 to 3:30, or Thursday morning, 7 to 11, or Thursday, 11:30 to 3:30. Again, we will be putting you in those time slots, so you don't have to worry about that, but those are visually how it all looks. Also, I want to point out that there is also lab time, and that's listed at the bottom. And again, you will be put in those time slots, but those meet at different time slots on Tuesday and Thursday. As an entering BSN student, you will be pre-registered, as I said, for your fall nursing and biology courses in July by your first year nursing advisor. You will register for your general education requirement through Student Information System, or SIS. The SAGES department will assist you in registering you for your SAGES first seminar, and your first semester schedule will be verified during our August Prepare to Care, which is our orientation session with your advisor.
When Kathy referred to the general education requirements in nursing, you'll see in the first year registration guide that you can access online that for nursing, the general education requirements are courses from the arts and humanities or social sciences. And so you need to choose a 3 or 4 credit hour course from the arts and humanities, or if you choose because of your interest in a topic or that your schedule allows, you may choose to fulfill your social science requirement, and you would choose a course from either anthropology, cognitive science, etc. But those are all listed in the first year registration guide under requirements for the Francis Payne Bolton School of Nursing. And I just put a link here. If you're unfamiliar with how to use SIS, you can go to that link, and there's a student guide for how to register for your classes using SIS.
What nursing items on the new student checklist? This is very important. These are things that you've maybe already familiar with, depending on when you view this video, but these are some things that we want to bring your attention to. Be sure to monitor your case email frequently this summer for the following things: the new student checklist. Also, email from Kaplan with your password.
I wanted to just say a few words about your Kaplan. That password will be sent to you during the summer, and some students have mistakenly deleted it. Please don't delete it, because you'll use that password through all 4 years of nursing, because there's learning resources and some assessments that are required throughout your nursing education.
Also, look for an email from ACEMAP, or referred to ACEMAP training modules. These are modules that are very important to get done before you are allowed into the hospital for clinical, which, as you hopefully know, will start the second week of the fall semester. So there are about 5 different modules that you need to read and study. You may need to take some notes, and then there'll be a test at the end of those modules. We think they average about 3 hours time, so dedicate some time for learning and testing on that, but you'll get an email referencing to that. Lastly, just listed there is a message from your advisor. So we'll be contacting you closer into August with any details that we need to update you on, and especially about our orientation coming up in August.
I wanted to cover some other details about the new student checklist that you've already been referring to. It's especially important that you complete your health record, and as you fill in your immunizations that you've received, you're also instructed to follow up by sending in the documentation that you've received the immunization or had the titers drawn. But you can check your progress there at myhealthconnect.case.edu, and that is a secure medical site that keeps a listing of your health information that's required. I'll briefly review the immunization documentation that's required, and these are what's required for anyone going in the hospital, whether it's medical students, dental students, podiatry students. The hospitals require that you've had 2 doses of your measles, mumps, and rubella vaccine, or a positive titer, and that's the blood test that says you're immune to it. You need to have a Tdap and a booster. You need to have received the booster. You need to have had 2 doses of varicella or a positive titer that you are immune to chickenpox. You need to have 3 doses of your hepatitis B vaccine or a positive titer that you're immune. The tuberculosis screening that's required by the hospitals now is 2 PPDs need to be planted and read, and they have to be a minimum of 1 week apart. Those of you who have had a tuberculosis immunization are required to get the quantiferon gold assay done. In addition, all nursing students are required to have the influenza vaccine in the fall, and the hospitals let us know when they're due, either in September or October of the year, and the school provides those for you. The deadline to submit your immunizations is June 30th, and it's very important that you get those in promptly so that the paperwork can be cleared through the hospital and we can get you cleared to start right away in your clinicals.
Data shows that some students struggle with some math in calculations and nursing math. So we have selected a math workbook. This is the picture and the details of that book that we need you to purchase and complete the work part of those completed papers and bring that to the first day of orientation.
Also on the new student checklist is information about how to order your nursing uniforms, and you see that it's through Robert's Medical Uniforms, and your nursing login is BSN 14, and they'll list for you there what's required. You need 2 nursing uniforms with patches, and they'll have the FPB patch on the sleeve. You also need 1 FPB blue polo shirt that you'll use in community and some other activities at school. And the warm-up jacket or lab coat is optional. If you're someone that often gets cold, you're not permitted to wear a sweatshirt in clinical, so please order the uniform warm-up jacket. And the link is also on the new student checklist for ordering your uniforms. Robert's uniforms will be at our Prepare to Care orientation if there's any problems and you need to exchange your uniform. There's just a picture of the students sometimes have a question about white shoes. You are permitted to wear tennis shoes as long as they're completely white, or just get a uniform shoe. And there's a view of the community uniform with khaki pants, the blue polo and khaki pants. And another thing that's on the new student checklist is the fingerprint waiver form, and as it explains there, if you're going to not have reached your 18th birthday by the day that the fingerprint and background check is done during Prepare to Care, then your parent needs to sign the waiver, and please send that in as soon as possible. There's other information about the background check listed on the new student checklist, but if you don't think that you're in the criminal database, your fingerprint can be done during Prepare to Care.
What? Again, nursing orientation. So this is very exciting. This is our time that we get to meet you and welcome you to CASE and to Francis Payne Bolton School of Nursing. All sessions on the 3 days that we have planned for you are mandatory in order for you to meet the clinical requirements for school and, more importantly, for the hospital that starts. When? Those are the dates. Prepare to Care will be, and we sometimes refer to it quickly as P2C, where you'll see that listed. But the dates there are August 19th, August 20th, and August 22nd. This is Wednesday, Thursday, and Saturday of your orientation week before classes start. You'll have been moved in and doing a lot of orientation on campus, but we have these times set aside for you, and these are open times that we've have verified with with the case orientation.
Some of the activities that will occur during Prepare to Care, as Kathy mentioned, you'll get your CPR certification and first aid. The background check will be done, and when Officer Schemmel does your background check, you need to provide him with a picture ID, a state-issued picture ID, and you need to know your Social Security number at that time. I said that Robert's uniform will be there for a uniform exchange if necessary. A nurse from the University Health Service will be there to review your My Health Connect to be sure that you're compliant with all the immunization requirements. There'll be a tour of the nursing building, and we're excited that the nursing resources that are available to you. So if you're interested in getting involved with research or involved with a club at the school or any other activities, there'll be representatives there during Prepare to Care to answer your questions. And then Kathy and I and Erin will get a chance to meet with you individually, and we'll be going over your fall schedule.
This is the Office of Student Services, a picture of it. It's located on the ground floor. You'll get to see this when you come for orientation. This will be part of the tour, but we wanted to just mention that. It has a very open door policy. It's unique from other offices on campus. It's our own in the School of Nursing. You can find financial aid office and the registrar for information and questions. And if you need any help on where to go or who to talk to, they're available. They also, as a side note, have lockers available in the School of Nursing.
So we wanted to kind of wrap up with a to-do list to kind of complement your new student checklist. So be sure to complete the immunization form and submit the required documentation. Please submit the fingerprint waiver form if it's applicable. Order your uniforms. Please complete the ACEMAP modules that are sent to you from Neone. Register for your classes that you haven't already been pre-registered for, and those are your GER and Phys Ed. Complete the math book, and we'll see you on August 19th.
Here is a list of contacts. Just again, I'm Kathy Money. This was Lorraine Jakowski and Erin Discenza, and other important people listed in the School of Nursing. And for more information, you can go to summerreghelp@case.edu. Thank you for listening, and we look forward to seeing you in August.